We're going to talk about sinusitis and acute pharyngitis. I'm actually going to talk about sinusitis on this slide and then add a slide for pharyngitis. Sinusitis can be divided into three categories: acute, subacute, and chronic. With acute, it's 1 week of an upper respiratory infection and it lasts 4 weeks. You will have pain in the sinuses, and when you palpate sinuses, you're palpating the maxillary, right there at the cheekbone, and you're palpating the frontal, which is right there on the forehead. And essentially that's part of your assessment, to palpate the sinuses. If someone has sinusitis, they usually have pressure, tenderness when you palpate those. They typically will have purulent drainage and congestion, fever, malaise. And that was for acute. Subacute symptoms will last 4 to 12 weeks. And then when we have chronic, it lasts longer than 12 weeks, and it's usually associated with nasal polyps. This one's difficult to diagnose. Typically there's no fever, no pain, no purulent drainage with chronic, but they may have face and dental pain. Nursing and teaching for sinusitis is on page 506, 27-4. Some of the things that people will use for sinusitis is saline spray times 3 days. They cannot use the saline spray for more than 3 days because it has a rebound effect and will cause vasodilation, and that is important to educate the patients on. A neti pot, this is where you're actually doing a nasal wash. You can use a decongestant, and if it does last longer than 10 days, they can prescribe amoxicillin. All right, we're going to talk about pharyngitis. This includes the tonsils, the palate, and the uvula. Usually you have a scratchy throat. There's typically red patches, exudate, fever, and with pharyngitis you will have cervical lymph node enlargement. With pharyngitis you can have a viral, and you can also have bacterial and fungal. So let me switch colors. You can have viral, bacterial, and fungal. So there's not really a lot that goes with the viral. It's more bacterial and fungal that we'll talk about. Bacterial, they usually have no cough, so absent cough. It's contagious within 24 to 48 hours of symptoms. Penicillin is usually the treatment of choice. You do want them to increase their fluid intake, preferably no spicy foods and no liquid, no citrus, because that's usually irritating. They can gargle with warm salt water, use a humidifier. And when we talk about a fungal infection, it's usually irregular white patches on the oral pharynx. And they use something called nystatin, which is a swish and swallow. So you also may hear someone called that they have thrush in their mouth, and that's very common to get thrush from antibiotics, and they will use nystatin, swish and swallow. So you're going to notice that when you listen to the podcast, I've actually skipped the trach slides. I want to do head and neck cancer first and then talk about tracheotomies, because that is one of the things that can be done for head and neck cancer. So I wanted to talk about it first. So when we talk about head and neck cancer, it's all about health promotion. Health promotion includes personal habits such as tobacco and excessive alcohol use and discontinuing those, oral hygiene, and being tested for HPV infections. Signs and symptoms of head and neck cancer include white and red patches, and they also will be called leukoplakia, which is the white patches, or erythroplakia, which are the red patches. The other thing that we want to be considerate of is that what will happen is there will be ulcers that do not heal. Maybe their dentures are starting to not fit correctly. They will typically have hoarseness greater than 2 weeks, difficulty swallowing and moving the tongue, difficulty swallowing, chewing, and moving the tongue are actually late signs. Some of the things that they would do in order to correct it are what you have listed here on your PowerPoint slide. The two that we're going to focus in on are the two bottom ones, radical neck dissection and a modified neck dissection. So when we talk about head and neck cancer, remember everything we talk about in the way that you're tested is based on nursing assessment. Thinking as the nurse, what do you need to know or modify or look out for? Tumors are staged by size, and that is a T component. And they are also staged by the number of lymph node involvement. That is considered an N. And then the extent of the metastasis, which is an M. Tumors or cancer can be staged 1 to 4. 1 to 4. And that's what they use, that T and M, to determine the stage. If you have a patient with a head and neck cancer that is stage 1 and 2, they are probably going to receive radiation therapy. One of the things with radiation therapy is they typically have dry mouth. And the technical word for the dry mouth is xeriostomia. So something you need to make sure that they constantly have is a water bottle with them or water. They need to avoid commercial mouthwash because of the alcohol content. It's very irritating. They need to stay away from hot and spicy foods. They typically are fatigued. The other thing you really need to be aware of is malnourishment is a big concern for these patients with head and neck cancer. They may have to have a prophylactic G-tube, bland food, and they do not need thin liquids. They need to have thickened liquids. Stage 3 and stage 4 is usually maybe a combination of therapy, surgery, radiation, and chemo. So we're going to just talk a little bit about radical versus modified. The radical accompanies a total laryngectomy to decrease the spread into the lymph nodes. It also may be removed, or what may be included is removing of the sternocleiomastule muscle, the internal jugular vein, the mandible, thyroid, parathyroid, and spinal accessory nerves. So this is a lot more involvement and a lot more things they're taking out if they do the radical. Versus modified, it's the alternative. We're trying to preserve the nerves and the vessels so they don't remove the major cervical lymphatic vessels in this particular modified version. Things we need to know or be aware of as the nurse in post-surgery is airway, wound care, nutrition, because we just talked about nutrition being an important factor. These patients usually come in malnourished anyway. Communication, because they're not going to be able to talk. We need to keep them semi-Fowler. Can't write today. This decreases the edema and limits tension on the actual sutures that are placed. Monitor vital signs, and these patients are at increased risk for hemorrhage.